Friends, welcome to my workplace at Ranaghat, West Bengal, India. This is a cataract with grade 3 nuclear sclerosis. This is a totally unedited real-time surgery. Let us observe the surgical steps. Povidone iodine 5% is applied over the ocular surface, and the ocular surface is thoroughly irrigated with BSS or ringer lactate. And now, this is the main incision with a 2.8 millimeter keratome on the posterior aspect of the limbus at around 11 o'clock. Visco is injected to fill up the anterior chamber, and it is applied over the corneal epithelium, and it improves visibility a lot. This is a side port on the left side of the main incision. And now Capsulorhexis is done with the help of this utreta forceps. The anticapsule is torn, a capsular tag is raised with the help of the tip of the utreta, and then an optimum sized rhexis of about 5.5 millimeter is done. Hydrodissection is then done with the help of BSS and a 27 gauge cannula. The nucleus is nicely rotated. And now is the time to introduce the phaco needle. It goes in with its bevel down. Some superficial lens matter is removed. Then the handpiece is turned to make the bevel up. And now watch direct vertical chop. Bury the tip into the substance of the nucleus very nicely. Hold the nucleus very firmly and then chop. Rotate it 90 degree and chop at another place. Rotate it 180 degree and chop the other heminucleus. So we have got 4 pieces. Now each nuclear piece is again subdivided if necessary into smaller pieces, and the lens nuclear pieces are emulsified using ultrasonic energy, which is about 60% in this case, though 60% is energy is not being used most of the time. Flow rate is 45 ml per minute and vacuum is 450 millimeter of mercury. And now the epinucleus is removed. There is very little cortex. We have only one side port. We can use either a coaxial irrigation aspiration device or a Simcoe cannula. This is a 23 gauge Simcoe cannula. This is a very gentle, safe instrument for cortical cleanup. How much vacuum you will be applying is absolutely in your hand, in your control. Cortical cleanup is done nicely, and then hydroimplantation of a single piece monofocal intraocular lens is done. Hydroimplantation means you keep the antechamber formed by irrigation and inject the lens. The lens goes into the capsular bag. The leading haptic goes into the bag and the trailing haptic is gently pushed into the capsular bag by the left hand instrument. And this is irrigation of the capsular bag and anterior chamber. Since this is hydroimplantation, there is no visco in the anterior chamber or in the capsular bag. The side port is closed by hydrating corneal stroma, and then This is the final lavage of the anterior chamber. At this time, a gentle stream of BSS is directed towards the corneal endothelium, and whatever visco sticks to the corneal endothelium is removed. The antechamber is nicely formed, and then the integrity of the wounds are checked. A cotton-tipped Johnson bud is used to check the wounds. Few drops of moxie is applied over the ocular surface and the case is concluded. Thank you very much for your attention. Hope this video will help you in developing your surgical skills. For vertical chop, you just have to hold the nucleus very firmly with the phaco needle using vacuum and then chop.